Hello, I'm Michael Roberts, Dean of the Gupta College of Science at Coastal Carolina University. I'm here with Dr. Terry Pettijohn, Chair of the Department of Psychology at Coastal Carolina University. Dr. Pettijohn, could you introduce yourself and tell a little bit about your background for our viewers?
Thanks for having me, Dr. Roberts. My name is Terry Pettijohn. I'm the Chair of the Department of Psychology at Coastal Carolina University. I'm a social psychologist, and I study how people influence the way that other people think, feel, and behave.
Thanks. We've seen a lot of stories in the news and on social media about people hoarding toilet paper and other items over the past month. Why is toilet paper so special?
Well, toilet paper doesn't really offer any special protection against the coronavirus, but it certainly has become the most popular item to purchase and talk about during this pandemic. It's similar to people buying out milk and bread when a blizzard's coming, or bottled water when a hurricane is coming. The coronavirus is new, and early on Americans were told a lot of conflicting information about what to do to protect themselves and who was the most susceptible. So just washing your hands was about all people were told to do, so they needed something else that would make them feel better prepared to handle this emergency. Toilet paper kind of filled that role. It provided a sense of security in terms of being prepared for the unknown. It's natural for people to want to prepare for an emergency in some way. People thought that they might be quarantined or stuck at home for extended periods of time, and they started thinking about what they would need at home. Toilet paper is a necessity. It's also fairly inexpensive, so they can stock up on toilet paper, not break the bank, and toilet paper really never goes bad, so it can certainly be used in the future. There's not really a downside to buying too much of it, except if it does sell out, then other people won't have it. And we can't really stockpile other items like fresh produce or meats because it will all go bad if we don't use it soon, and it's fairly expensive. So panic buying, especially when covered extensively by the news and social media, becomes a significant self-fulfilling prophecy. There's so many posts on social media about toilet paper and jokes about it. Seeing news coverage of empty shelves make people think that they too need to buy this product, and so whenever they went out to the stores, they purchased it as well. And then when everyone panic buys an item like toilet paper, it does run out. And so then the manufacturer has a hard time kind of keeping up with the demand. And so every time someone goes out, they're trying to think about how much they're going to need for the next couple of weeks. And whenever they can buy it, they're trying to buy it. So here we are, over a month later, and it's still hard to find toilet paper in some stores.
We've all heard the term social distancing over the past month. Do psychologists approve of this term, or do they have a better option?
So there are a group of social psychologists who are really concerned about using the term social distancing because it implies that we should be socially distanced or removed or isolated from others. A better term would really be physical distancing. And I've seen some sources trying to use this a little bit more because we want people to remain socially connected to others during this tough time. We just want them to stay at least 6 feet apart. So the term has a psychological meaning. At this point, everyone really knows what we mean by social distancing, so trying to rebrand the practice might not be worth it, might be more confusing, but it would have been nice if the term physical distancing was used more from the beginning.
To overcome the stresses of changes in routine, uncertainty, and a lack of social contact during these stay-at-home orders, how can people remain psychologically resilient?
The most important goal for people is to try to keep their stress levels to a manageable level as much as they can. People have fears about the virus itself, how to avoid getting sick, worrying about family and loved ones, loss of employment, money concerns, fear of food running out, medications, home supplies, and even death itself. Some tips that you can do to try to reduce your stress levels and anxiety could include things like, number one, trying to stay optimistic and expressing gratitude daily. Think about the positives of this situation, such as being able to spend more time with your family, not having to deal with as much traffic or driving at all on the way to work, not having to dress up for work if you're staying home. If you still work, be grateful for a paycheck. So there's a lot of different ways. By looking at this situation, you can reframe it and maybe find something to be more grateful for. So instead of saying things like, I have to stay in my house or apartment, you can say things like, reframe it so that I get to stay in my house or apartment. I know that in our household, for example, we've got to spend a lot more family time together eating meals, and that's not something that we ordinarily could do, and I'm very grateful for things like that. Number two would be keep socially connected in some way. So find some time each day to call someone, to video chat with friends, family, colleagues from work, people that you haven't connected with in a number of years. These types of things will help minimize your feelings of isolation, and it's a good uplifting feeling throughout the day that you can look forward to. Number 3 would be try to keep a routine. Try to wake up and go to bed about the same time every day. Get a healthy amount of sleep. I know for some people sleeping has become really difficult now, but it's really important that we get our sleep. You can take naps if you need to, but build in time each day for work, for social connections, and then also for exercise as part of a routine. Get up in the morning, get dressed, don't wear your pajamas all day for several days in a row, as tempting as it might be. Take a shower, take a bath, brush your teeth, groom yourself. These types of things make you keep a schedule, and that's important. Getting outside is also very positive. The sun helps elevate your vitamin D production and can enhance your mood. So try to keep some type of regular routine, because that's going to be beneficial for dealing with the stress and anxiety of the uncertainty. Number 4 would be limiting your news consumption. Watching hours of news coverage each day has been associated with increased anxiety. So you should be informed, but you don't have to have the news or the television on or looking at social media at every moment all day long. Social media threads now contain a lot of information about coronavirus, and so it might be good to try to limit some of those as well, or to maybe control some of the content so it's more about your friends and positive stories, as opposed to the dangers and the fear of the uncertainty and things that are happening. Number 5 would be try to laugh and have fun. So take breaks from work and being at home. Play games, dance, watch funny movies or shows or comedians. Watch Jimmy Fallon as he broadcasts his show from his home. There's some great videos, memes, TikToks that can also make people laugh about our current shared experiences, about homeschooling, about trying to share computers at home, about toilet paper being out in the stores. Laughter is really great medicine and can improve your mood and your life views. Number 6 would be try to find some things that can distract you, like take up a new hobby, learn an instrument, binge watch shows like The Tiger King on Netflix or some other series that you've wanted to watch for a while. Read a book, read several books, do a home project that you've been putting off, clean and organize your closet, plant a garden, write, be creative, color. Anything that you can do to kind of take your mind off what's going on in the world can help you kind of pass time, and can also give you a purpose and make you be more creative and increase your mood. And the last one, number 7, would be to adjust your expectations. These are not normal times. This is not business as usual. You will not be able to work as normal and be as productive as you usually are if you're trying to work from home, or even if you are going into work. And that's okay. Don't think that just because you have more time, you can get lots more accomplished. Creating a checklist with a number of things that you think that you're going to get done, you might not get to those points. So take care of yourself and don't set the bar too high now, because, as I mentioned, times just aren't normal. Now, none of these is one right way to cope. You're going to have to try different things and see if any of these things work for you, and kind of use some trial and error. But be flexible and adapt.
There are lots of positive stories of people helping others during these difficult times, especially with our healthcare professionals. Why do people help others when it's potentially dangerous or could lead to personal costs to the helpers?
There are also lots of great stories about people helping others during this COVID-19 pandemic. Healthcare workers are risking their lives to help patients, but there are also great stories about people donating protective gear or ordering takeout from a local restaurant and delivering it to hospitals so the nurses and doctors have something to eat. Kids and parents were quick to sew masks. Communities are supporting local businesses by buying gift certificates for use later. Celebrities and musicians are hosting live sessions from their homes to raise money for different groups affected by COVID-19. Yoga teachers are offering free sessions on Facebook. Textbook publishers, communication companies are providing access to their products for free. People are offering to help deliver medications or shop for immune-compromised and older people in their communities. Younger people are teaching older individuals and others that are less tech-savvy how to connect virtually via video messaging. But the question is why? One psychological theory suggests that this makes people feel good to help others, even if there is a cost involved. You could get the virus if you help others in some ways. It could be a financial cost involved. But helping boost our mood makes us feel happy, so it's worth that kind of risk. It also improves our self-esteem. There are social norms working here as well. We want to be considered as helpful. We see our friends helping, and we want to be one of the other ones that's helping as well. We want to be accepted by others. individuals that aren't doing this, individuals that hoarded things like hand sanitizer or protective gear in an effort to price gouge and make money, have been socially shunned by the media and audiences. We're going to remember who tried to profit off of this pandemic later. Helping also provides purpose, makes us feel a greater sense of control in terms of being able to combat the effects of this virus. Doing something is better than not doing anything and gives us some type of a purpose. We're social beings. We need each other. We need businesses to survive. Businesses need people to purchase their products in order to survive. We rely on each other for survival, so it makes sense that we can help others when we can so that they can help us when they can. Helping can also be contagious and can make a difference in people's lives. The more people that we see helping, the more we want to help as well.
What are some of the sources you could recommend for dealing with the psychological consequences of this pandemic?
Yeah, so there's several sources that offer some great information about dealing with the psychological effects of this pandemic. The American Psychological Association at apa.org and the Association for Psychological Science at psychologicalscience.org are really great professional psychology sources where you can find a bunch of research articles, videos, tips. A lot of good information can be provided at these sites. I've also tried to link some of those to our CCU Psychology Facebook page and also on our other social media pages. I know the Live Well office at CCU has a very nice resource page as well. I posted a link to their resources on my Moodle page for my current classes. There's good things on there about meditation and breathing exercises and ways that you can reduce anxiety and stress during these tough times. If you are struggling, try to reach out to someone. If you do need professional help, try to contact a counselor or a therapist. Right now, besides health services that are offered virtually by teleservices, they're also available for mental health, and so you can take advantage of this. We're all in this together. Your actions are very important, and we need everyone. Please take care, be safe, and stay healthy. Thank you.
Thank you, Dr. Pettijohn. I really appreciate you being with us here today.